Hi there. I'm excited to share this comprehensive guide on gallbladder symptoms. We'll be drawing from expertise shared by Dr. Rajarshi Mitra, a laparoscopic surgeon and proctologist practicing in Abu Dhabi, UAE. Together, we'll explore the key signs and symptoms from a surgeon's perspective, helping you understand when medical attention might be needed. Let's dive into understanding your gallbladder health. Our mission today is to give you the knowledge you need to spot potential issues early. We'll walk through how your gallbladder works, common problems that might develop, and the range of symptoms you should know about, from mild concerns to serious emergencies. Your gallbladder is truly fascinating, a small but mighty player in your digestive system. Think of it as a storage tank for bile, nestled just beneath your liver on the right side of your abdomen. This pear-shaped organ springs into action when you eat fatty foods, releasing bile into your small intestine to help break down fats and absorb vitamins. When it comes to gallbladder problems, gallstones are usually the main culprit. These are hardened deposits of digestive fluid that can range from tiny as a grain of sand to as large as a golf ball. If these stones block bile flow, they can trigger inflammation and infection. While stones are most common, some patients develop gallbladder inflammation without stones, infections, or in rare cases, tumors. Let's talk about that distinctive pain that suggests gallbladder trouble. You'll typically feel it in the right upper quadrant, just below your ribs. It might feel like sharp stabbing, a dull ache, or crampy discomfort. Watch out especially after heavy or fatty meals. That's when these symptoms often appear, and the pain might even spread to your right shoulder or back. The story of gallbladder issues doesn't end with pain. Your digestive system has other ways of sending warning signals. During acute attacks, you might experience nausea and vomiting. After meals, bloating and indigestion could become frequent visitors as your gallbladder struggles with bile release. Keep an eye on your stool color too. If it becomes pale or clay-colored, that might indicate a bile blockage. Some people also notice long-term changes in their bowel habits, swinging between diarrhea and constipation. There are certain red flags that should send you straight to the emergency room. While mild symptoms might be monitored, two warning signs demand immediate attention: fever with chills, possibly indicating cholecystectomy, an inflamed or infected gallbladder, and jaundice, that yellowing of skin or eyes that signals a serious bile blockage. Women face some unique challenges when it comes to gallbladder issues. Pregnancy brings hormonal changes that can affect gallbladder function, and both hormone replacement therapy and oral contraceptives can increase the risk of gallstones. Women often experience subtle symptoms they might brush off as simple indigestion, along with more noticeable nausea and vomiting. Recognizing these warning signs is crucial. A gallbladder attack is something you never want to ignore. It's a serious emergency requiring immediate medical care. The hallmark sign is intense, sharp pain in your upper right abdomen that might shoot to your shoulder or back, often lasting for hours. If this hits after eating fatty foods and comes with severe nausea and vomiting, don't try to tough it out at home. Head straight for medical care and avoid eating or drinking until you're properly evaluated. Diagnosing gallbladder issues is like piecing together a puzzle. Doctors start with a thorough physical exam and medical history. An abdominal ultrasound is their go-to tool, quickly revealing gallstones and inflammation. Blood tests help spot complications like infection or liver problems. For trickier cases where ultrasound results aren't clear-cut, they might turn to advanced imaging like CT scans or MRI to get the full picture. Here's something crucial to understand. Ignoring gallbladder symptoms isn't just risky. It's potentially dangerous. These problems don't typically resolve on their own and can lead to serious complications. We're talking about chronic cholecystectomy with ongoing inflammation, potentially life-threatening infections, and bile duct blockages that can harm your liver. There's also the risk of pancreatitis, where blocked ducts can trigger dangerous pancreatic inflammation. Treatment for gallbladder issues typically follows one of two paths. For milder cases, we start with conservative management, adjusting lifestyle habits and following a low-fat diet with pain medication when needed. When gallstones become a persistent problem, the definitive solution is surgical removal of the gallbladder through cholecystectomy. Each treatment plan is carefully customized to fit the individual's specific situation. Modern gallbladder surgery has come a long way. Laparoscopic cholecystectomy is now our gold standard for removal, revolutionizing this common procedure. Instead of one large incision, surgeons use specialized cameras and instruments through several tiny openings. This advanced approach means less post-operative pain, minimal scarring, and faster recovery times compared to traditional surgery. A perfect example of how medical innovations keep improving patient care. Let me share some vital warning signs you should never ignore. If you're feeling discomfort in your upper right abdomen, especially after fatty meals, pay attention. Your body might be sending you important signals. Keep those emergency red flags in mind. Fever, chills, or jaundice require immediate medical care. I can't emphasize enough how important early intervention is. Waiting too long can lead to serious complications. And while it's tempting to Google your symptoms, always get a proper medical evaluation for accurate diagnosis and treatment. Knowing these gallbladder symptoms is your first line of defense for better health. If any of these signs sound familiar, please reach out to a healthcare professional. They can properly diagnose your condition and work with you on treatment options. Remember, early intervention isn't just about managing symptoms. It's about protecting your long-term health and maintaining your quality of life. Before we wrap up, I need to emphasize that everything we've discussed today is purely educational. While this information is helpful, it can't replace professional medical advice. Always consult your physician about your specific situation. In emergencies, don't wait. Seek immediate medical care. This presentation, though thorough, doesn't establish a doctor-patient relationship or substitute for direct medical consultation. Thank you for your attention.